Today, May 26, 2020, we have 706 confirmed cases, still 25 deaths, 2 people in the hospital, 1 ICU, 311 people home, and 368 recovered. The current calculated case fatality rate based on confirmed cases tested is 3.5%. And we are down to just 93 people who we are actively monitoring and have completed 841. So this makes for not that interesting of a graph anymore. Basically, most everybody is not in the hospital. And this is what our hospitalization trend has looked like since early April. And you can see that since really about the 8th of May, we've been hovering in here in less than 5, and for several days here, 2 and even 1 at one point in time. So just an overall breakdown with less than 0.1% in ICU and in the hospital. We are at 52.1% recovered, 44.1% basically at home, 3.5% deceased. Our cumulative case curve looks like this, and I think the length of it makes it harder to see that it's flattening out, but it is. When we look at our incidence curve in terms of daily new cases, we are definitely trending down and have been trending down for quite a while. A lot of bouncing. Percent positive per day. We did have a little bit of an uptick in our percent positivity last week in the region, as stated by the state as they looked at the regions. However, here in Ingham County alone, we seem to have been fairly steady for the last week or so. So your rolling average and your percent positives per day look like this. So you do see that little bit of an uptick here in the percent positives. So, you're going between 2 and 4%. So on your previous graph, it does not look very significant, but they are looking at that little bit of an uptick in percent positives. So when we look at our cases by zip code, we still have our 48911 zip code now with in the range of 211 to 220 cases, 48910 approaching 100, 48823 at 71 to 80, and then 48854, 48906, 48864 coming down from there. So that's Holt, Mason, and another Lansing zip code. So our cases by zip code looks like this in terms of case numbers and shading. And then when we look at that by rate, we see this 48911 and then Lansing 48910, excuse me, and then Mason as the next highest in terms of rate per 100,000 people. We did create a heat map. So this is a zoomed in version of that heat map. You can probably see here the border to our 48911 zip code, which goes all the way down through here. So it includes all of these heat spots, in addition to some in 48910. This, I believe, is 48912. And then I think 06 might be out here coming towards the airport. Here's the Capital Area Regional Airport out here. And then this is just a little bit of a zoomed out version that gives you the full county. This kind of dense little spot right here is as a result of cases at Ingham Medical. So we are now 49% male, 51% female. By age group, this graph has looked similar for a really long time now. So as cases change, they're not changing a whole lot. When you're adding very few cases in per day, it doesn't tend to dramatically change percents. When we look at those by race, we are at 46% Caucasian, 27% Black, 16% Asian, 4% others, and 7% unknown. So we are getting that unknown category down. If you look at those percent positive confirmed cases by race in 48911, you're at 41.4% in Asian, 29% Black, 19.5%, and then 1.9% other. A few new cases in 48911 did change those numbers a little bit. So you see the Asian population still at a rate of 39,860. Our African American population at 631, Caucasians at 350. That puts the Black African American in that particular zip code at about 1.8 times. The Caucasian and Asians are almost 12 times the prevalence rate for Caucasian. And then here is our race-specific prevalence rate across the county as a whole. So again, you see that significant difference between the Caucasians as well as African Americans and Asians as well, and others. Percent COVID cases by ethnicity: Hispanic, Latino 10.5%, non-Hispanic or Latino 79.9%. We're down to 9.6% unknown. So our rates look like this: 320.8 Hispanic or Latino, 209.1 non-Hispanic or Latino. I didn't redo those calculations in 48911 because nothing has really changed there. If we look at our deaths by age, 12% are 50 to 59, 20% 60 to 69, 28% 70 to 79, and 40% over the age of 80. If you look at that by sex, it's 52% male, 48% female. And if we look by race, it is 32% African American, 64% other, 64% Caucasian, and 4% other. And then by ethnicity, 84% not Hispanic or Latino, 8% Hispanic or Latino, and 8% unknown. So that is where we stand today. Did I stop sharing? I can see all of you. Questions?
We don't have anyone in the queue, so if you have a question, just please chime in.
I have a question from somebody in my newsroom here at News 10.
Sure.
Somebody is asking about the auto plants opening up this week. I know is tomorrow. Do you have any concerns, and are you guys working with UAW and automakers on a protocol?
All industries are working with their own kind of industry sectors on protocols and plans, as well as the state, which has created guidance documents. So to the extent that they call us and ask for assistance with those, we certainly ask them, we help them to a certain extent. As you can imagine, we're a health department doing contact tracing and testing and any number of other things. And so we can't be the personal advisors and guidance document creators for every employer in town, but we do help as much as we can. The guidance that has come out from the state and the CDC is very clear and very thorough. There's lots of precautions, physical and environmental precautions, those sorts of things. So they are working through all of those things in order to be safe in the opening. So, but I don't know a lot about their specific plans.
Thank you.
Dave Ackerley?
Linda, at the governor's briefing today and with Dr. Caldoun, they discussed the new state dashboard showing serology test results, and that's something that's been added. The CDC has some guidelines, but Dr. Caldoun seemed, it kind of mirrored what you've said here before, that there's a lot about those that are kind of up in the air. Is there value in that right now? I mean, we get hit with a lot of info, and usually it's good, but we like more than less. However, are you putting much stock in those serology tests now that they're kind of in widespread availability?
Yeah, I really can't at this point put a lot of stock in them in terms of it actually giving me information to take any action on or to inform me about what's going on, because we just don't know. And that's what's been said over and over again. We don't know what the results mean. We have a test. Those tests, there are a variety of different ones being used out there. I would encourage anybody to ask anybody who's doing a test on them, whose test are you using? What is the sensitivity and specificity of that test? So that you know. But essentially, yes, it's being put into the system, and what that does is actually present some challenges for us in the sense that they end up in the disease surveillance system as, I believe, probable cases. We go in there and make them suspect cases because there's no reason to call them probable until we make phone calls. Then we actually have to call those people who have a positive serology test and try to ascertain whether in the last, say, 5 months they've had symptoms that might be consistent with COVID-19. And if they have, then I have directions to move them over to probable cases. But clearly it doesn't drive us to any contact tracing or anything like that. And is, just more phone calls to make. But, we call somebody and they had symptoms in February. Okay, we can make you a probable case based on serology and based on those symptoms. But it doesn't give us a way to call people and say, okay, you were exposed to this person in February. So, it just doesn't do a lot for public health. And the results in general are, they're difficult to interpret in terms of really giving you information. We don't really know that much about what they mean.
Okay, can I ask a follow-up here, Amanda? So is there a chance that people who get one of those as a positive will then have a false sense of security?
Absolutely. Yeah, sorry. Finish asking. Sorry. Yeah, I think there is, because I think if somebody gets a serology test that says they're positive, then they're going to say, I've had it, I'm immune, and so I'm safe. And that's exactly what we don't know. We don't know whether that means that or not. And we don't know that positive is a true positive, because some of the tests that are out have, say, a 5% or so false positive reliability on them. So they're 5% false positives, false negatives, those sorts of things. So, the actual predictive value of a test that has a 5% false positive rating on it, when maybe the public in general, the prevalence might be 5%. Let's say the serology prevalence is, say, 5%. That means if you do tests and you get 10 positives, you're about 50% sure that those positives are true positives rather than false positives. If it's a 5% false positive and you expect a 5% prevalence. So it's 50% accurate. The more your prevalence goes up, the more accurate it's going to be.
They could be worthless, though.
Yes. There is every reason to believe that at some point in time, we just don't know when. So there's this whole transition that occurs with antibodies. Your body first creates what's called an IgM, and then it continues and it creates an IgG, which is the longer standing immunity. Then a lot of the questions and the reason we say we don't know, it's not about, oh my gosh, people are never going to be immune to it from having had it or a vaccine. I mean, clearly, if we're giving a vaccine or working on a vaccine, we have reason to believe that there could be immunity. But we don't know. We don't know for how long. We don't know how long it takes for that immunity to build to a certain point where there truly is immunity. There's just so many unanswered questions that basically the result is a big, I don't know what that means.
All right, thank you.
Yeah.
Does anyone else have a question for Linda?
Hi, Linda. Chris Lewis from Fox 47. We had a question that was sent in, and it was really asking about the fact that many school districts are looking to find ways to celebrate the success of their students at some type of graduation in the future that would bring people together. But with social distancing guidelines in place, they're a bit at a quandary at what direction they should follow to be able to be in the guidelines of the health department, but also the state. Do you have any guidance that you're offering to school districts right now on this?
We haven't gone to any guidance outside of the governor's guidance of no gatherings of more than 10 people at this point in time, so 10 or less. So when we start to project, for example, you know, festivals, fairs, concerts, those sorts of things, which I would put, you know, a fairly large graduation, because, you know, lots of family wants to come and all of that sort of stuff into that category of a fairly large gathering. You know, we're not anticipating that there's going to be very much of that through the summer. But we don't know an exact date yet. So I think it's going to be very challenging. I know that, you know, at the university level, it's huge. At the high school level, I don't know what they can manage. I know that, like, when I went to university and when my kids did, they broke them up into sections. So like the entire College of Arts and Sciences had a graduation ceremony. You know, I don't know whether they can break them up into sections and somehow celebrate in a way that keeps fewer people there when we get to, you know, gatherings where we can have larger than, say, 10 people or what. We really don't know how to guide people right now with that question, other than I wouldn't put anything on the calendars for right now until we know a little bit more. And that's hard.